So oxytocin, compounded into nasal spray form, can also be used not only just for the abortion of migraines or the maintenance therapy of keeping migraines away, which saves the day for so many women and some men too. But oxytocin in nasal spray form can also be used for insomnia because it's an anxiolytic. It actually was used first in its rebranded, repurposed way for PTSD victims because they found that they had a very it had a very good calming response. So oxytocin, multi-versatile, repurposed drug, let's say, can be used for PTSD, can be used for anxiety, it's an anxiolytic, can be used for insomnia, has also been used to help lower the cortisol response. Those are just some of its purposes that a practitioner may know of how to apply it in a nasal spray form. And the nice thing too about it is that you can use all of the sprays all at once, or you can split up the sprays throughout the day depending on what we're trying to achieve in your body system. So other things to know about oxytocin would also be that because it can be an anxiolytic, either as its primary or secondary unintended consequence, it can lower your blood pressure a little bit. It can also lower your heart rate, not by like 20, 30 points, but something maybe like 2 to 5 in response because it is a calmer effect for you. Other side effects can be brain freeze. If you put this up your nose and you keep it in the fridge, watch out. Or could be possibly for some women, and I've only had this happen to one female ever, and she used it that day, this happened, and then she moved on and she continued to use it and never had the issue again. So was it really oxytocin or was it something else? Jury's still a little bit out, but if you read the medical literature, it can say uterine contraction, which yikes, I know ladies, not something you ever want to really think about happening in response to a pharmaceutical that you're using, or a repurposed pharmaceutical in this case. But I have had that only happen again once in an isolated case, and it never happened again. So who knows? But, I probably wouldn't recommend this if you're going to go have some type of feminine procedure performed or IUD placed or withdrawn, etc. around that timing. So we would want to be just a little selective, maybe perhaps in the female more so than a male physiology when we're looking at side effect response. Now, who this also is not for would be people who have a history of bipolar or mania disease. Who this also is not for are females that have a history of uterine cancer. And lastly, who this also may not be for would be males who have benign prostatic hypertrophy. Other thing to be aware about would be this can potentially have some interactions. The main one in my field that I see is we want to be careful if you're on a repurposed pharmacology or repurposed pharmaceutical drug called low-dose naltrexone. Oxytocin and LDN can, in the literature again, compete for the same receptor site response, which can decrease or increase one or the other's efficacy. And so there's been several cases that I've had, well, I won't say several, there's been a few, less than 5, where I have used oxytocin and low-dose naltrexone concurrently, and I've spoken with pharmacists who have crafted this in the compounding pharmacy in multiple states, and they all agreed it's fairly safe to do. You just need to watch and monitor for response. But for example, I've had a Lyme's patient who's been stable on low-dose naltrexone. They wanted to add in oxytocin for some calming or for some actual general pain mitigation, because I did forget to say that this can also be used for chronic pain. And they use it and the pain is helped and alleviated, but they did need to up their low-dose naltrexone just a touch. And so it's just something to be aware of if you're on low-dose naltrexone. That's the biggest one that I see in terms of interaction forms that may need to be readjusted based off of this new introduction of the oxytocin hormone. Something else you might want to know, well, how much does this cost? It'll depend on the pharmacy. It'll depend on the milliliters in the bottle. It'll depend on how frequent you're using it. But for example, a compounding pharmacy that I'm aware of, somewhere between $50 and $60 for a 30-day prescription. It's a pretty routine response. And then other things we want to talk about when it comes to oxytocin is that nasal spray is not only its sole form. So I don't have anything with me, but oxytocin does come in sublingual tablets that you can dissolve prior to intimacy. And that also can help for both ladies and men, encourage the sexual response. It can help optimize the feeling of that love and bonding experience together. And I have seen people, or have witnessed testimonials where people said that that was very helpful to them between their partnership when it came to the intimacy response. So oxytocin is a very interesting hormone, very interesting repurposed pharmaceutical to some degree, and something that doesn't quite break the bank when it comes to its use, either acutely or long term. Last function that I forgot to tell you about too, actually, is in the post-COVID world for long haul. This can be helped to be used, or this can be used to be helped, excuse me, restore taste and smell. I have had a case testimonial where that really worked. It worked so well, actually, that the gentleman forgot to come back for his follow-up because he thought, we're done. I was healed and it was restored. And so here as a practitioner, I thought, oh, what happened? He didn't follow up. And here on the other end, on his experience, he was like, well, we fixed the problem, so there was no need to come back. It can restore taste and smell, but also it can help with tinnitus, which I have also used. That does seem, just from anecdotal stories, seems to be more relevant on the male end for some reason. I don't have research to support that objective finding, but I have witnessed it to be true. Can help kind of lower the ringing in the ears if you have some chronic tinnitus. This may be something to try if you've not had a novel solution applied in your ringing repertoire of differential tools that you can use. So Oxytocin, very interesting repurposed pharmaceutical kind of drug, but has a lot of applications that may be relevant to you, and would love to talk with you if this is something that you think that you might want to try, if you are a good candidate for it and if we can use it safely. I would love to speak with you about that.